Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. And right now, Dr. Darrow is speaking with Jonathan.
Jonathan, you still with us? Dr. Marc Darrow here. Hello, Jonathan.
Well, he can call back at 866-870-5752.
Absolutely.
And in the meantime, you had some things you wanted to say that probably will help other people as well.
I always have something to say.
I know. That's a good thing, right?
Yeah. Sometimes I say it too fast. Well, we're here to treat the musculoskeletal system, the joints, the tendons, the ligaments, but also, and that's including neck, back, arthritis, anywhere from the back of the head to the bottom of the feet. So, yeah, we inject all over the body. We don't just stick to like knees like other doctors do. We use ultrasound guidance so we can watch where the needle goes. That's very important because, for example, if your doctor injects your knee or your hip or your shoulder without ultrasound, they're going to be missing the spot they're trying to get to at least 33% of the time, according to the studies. So you make sure if you're getting injected by someone else, you make sure they have an ultrasound there. A lot of doctors don't know how to use ultrasound. I actually have 3 of them in the office on little tables with wheels, and we run them around to all the rooms with the patients. One of the first things we do when we get a new patient is we take a look inside and see what's going on. The next thing we do is we touch the body. We got to find where the pain is coming from. And Jonathan, who just called us, said he's got some pain in the front of his shoulder. And that's typically so easy to fix. Simple. That's what I had. Unfortunately, I had a shoulder surgery where they did an acromioplasty. That means the acromion, the top bone of the shoulder, was cut down for no reason at all. Really, no reason at all that was done. But I didn't know anything when I was was it med school I had it done? Yeah, I had it done in med school. And I'm not against the surgeon. I love my surgeon. I worked with him quite a bit. But I'm against these surgeries that never should be done. And after the failed surgery, 4 years later, when it was still miserable and I had limited range of motion and pain, what did I do? I injected myself. What happened? Healed overnight. Don't expect an overnight healing with stem cells or platelets, but it happens. People have very strict expectations for me sometimes. They'll come back. I typically will check a patient out after a treatment about 2 weeks later, and some patients come back and they go, "It's not healed." And I go, "It's not supposed to heal that quickly. We're just growing tissue." It's like if you throw grass seed on your lawn, how long does that take to become stable, good grass? Do you jump on it right away? No, you let it heal. Sometimes it takes a few treatments. If you want to get more specific information on that, you can call our office and get a free consult on the phone with our staff, and they can give you more information about that at 800-300-9300. So I'm going to go to an interesting question here, Nita, if you're cool with that.
Absolutely. Let's give the phone number first.
Oh, boy. 866-870-5752. You can call me there. 866-870-5752. And if you call, I'm going to send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with the foreword by Suzanne Summers. All right. Also, we use these not just on the musculoskeletal system, the orthopedic system, but we use it to stimulate new hair growth on the top of the head. If you're starting to thin, it's a great treatment for you. And we also use it on the face. We do something called the vampire facelift and regrow the collagen of the face and make you look young. All right, so this one's coming in. It says, avoiding hip replacement. Dear Dr. Darrow, your website looks great. I'm 69 in good health, but I have arthritis. Hands, toes, hips. I'm not crippled by it, just pain and stiffness. I had a hip replacement 15 months ago, and my left hip is not good either. I don't want another surgery. The first one didn't work well. It's manageable for now. I was considering a Euflexa shot, which is, by the way, for you guys listening, sort of a gel. It's taken from the rooster comb of a rooster. And it's a liquid. It's a thick liquid. And would I do that? No, I wouldn't, because it's basically hyaluronic acid. When we inject stem cells or platelets, we actually create hyaluronic acid right there. Why would I put a shot of something that's synthetic in there? I wouldn't. By the way, I did inject Durolane into my left knee a couple of years ago, which is another hyaluronic acid, a synthetic, and my entire leg, my knee, my thigh, and my calf blew up, and it was swollen for, I think, about 5 months. And I was on crutches in total misery. Did I have an allergy to it? Probably. That happens. I know I injected actually into the joint and not the soft tissue because I used an ultrasound to guide my needle. So people have allergies to this. Sometimes they need to have an incision and drainage in the surgical suite once they get this swelling that takes place. My doctor, I won't say where he is or who he is, but it's a famous clinic in LA. I've done physical therapy. It feels better in the short term. My low back hurts too. I imagine, I can't read what this is. I have been imagining something. A friend of mine sent me your information. She's in Orange County, too far for her to come to you. I guess a consult makes sense to me. So Orange County is not too far to go. We have people fly in from all over the world to get treatments here, all over the country. I think our average patient drives about 2 hours to see us. So are you going to stay in pain or are you going to get healed? Orange County too far? I don't think so. I've actually flown around to get different treatments for different health issues. I'd rather drive, than stay in misery. How about you?
Absolutely.
So I think this patient is a great candidate for platelets and or stem cells. We treat hips all the time. They also have arthritis in the hands, toes, and the hips. We treat that all the time. These are just everyday things for us. And I'd be very glad to see you and do a consult, touch the body, look with the ultrasound, do a great exam, and find out where your pain is coming from. And then if you're ready for it, we inject the same day as your consult, if you like to. Most people do. Some people want to think about it afterwards. Some people actually go and get surgery after I talk to them. I don't get it, but that's what they do.
That's kind of strange.
Well, it's kind of strange, but, human beings are strange. We're all strange, aren't we, Nita?
Yes.
Aren't we all kind of idiosyncratic?
Very true.
Not me, not you, but everybody else, right?
That's right. We're perfect.
Sure. All right, I'm going to go to a knee question here, Anita.
Okay, can I give the phone number first and offer up your free book?
I will let you.
866-870-5752. And please call because we have time left to get you on the air. Also, you get a free book, Dr. Darrow's latest. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it actually has 264 scientific studies.
Yeah, I mean, there's so much research being done on regenerative medicine with stem cells and platelets. It's crazy. It's the huge field that's coming up in orthopedics now. And I honestly don't know why surgeons are doing all of these surgeries that can be healed with simple injections. I don't get it.
Because people don't know. They don't find out.
All right, here we go. This is kind of long but interesting, so I want to do it. It says, failed meniscus surgery. Dear Dr. Darrow, I had a medial meniscus repair on my left knee in July. I am so much worse after my surgery. Common, that is. The pain is worse and, in fact, unbearable. I have to elevate my knee by putting a pillow underneath the back of my knee. The surgical incision site is numb. I find it hard to bend or straighten my knee. I can't raise it up. I had a 3D MRI last week of my knee, and it showed that I have a vertical tear in my medial meniscus and a horizontal tear in my lateral meniscus. Prior to surgery, my MRI showed a medial meniscal tear. I would be grateful if you could answer the following 3 questions. Should I have a revision surgery? My answer without examining you is no. If I examine you, I might change my mind. But I have to see what's going on with my hands, look with the ultrasound. Meniscal tears are not a negative to healing. I have 2 meniscal tears, medial meniscal tears in my knee, both knees, and I have no knee pain now because I've injected both of them with stem cells. Are they still there? The tears are there. They're not as bad, but I'm not going to keep injecting them because I don't have pain. Will I have meniscal tears the rest of my life? I don't really care. Do you understand that? It doesn't matter. When we do MRIs of people that have all kinds of bad stuff in their body, they don't necessarily have pain. You can't equate MRI, X-ray, CT findings with pain. Get that straight. Should I have an MRI done of my knee with contrast? No. Why are you going to put contrast in your body? It's not good for you. What's it going to show? I need to examine that with my hands. What other test would you recommend to get an accurate diagnosis? My hands. Do you get it? The hands tell you everything.
I think so.
Looking forward to hearing from you, and thank you so much, Dr. Darrow. I love listening to your show. So, I don't know what to tell you guys. Don't jump into a surgery. Get somebody who does examinations. I always love talking about my grandfather, who was a doctor born in the 1800s. He didn't have MRIs, and you know what he called the surgeons?
I'm ready.
Don't kill the messenger. I'm just saying what he said. He called surgeons butchers.
Ouch.
I don't like that negative spin on surgery. Okay? But in most cases for musculoskeletal pain, I don't see that it's needed. We have something that is very conservative now. It's called regenerative medicine. I've been doing it over 25 years. It's simple. You walk in the office, you drive yourself there, you get some injections, and you walk out and drive yourself home. You don't need a driver. You don't need anesthesia. The side effects typically are a little bit stiffness for a day or so afterwards because we're creating inflammation. The body uses inflammation to heal. It draws fibroblasts from all over the body to the point of injection, which are cells that grow back collagen and cartilage or soft tissue. So I don't get it, but that's life.
It takes a while for people to learn a new paradigm, I think.
We're getting a new caller coming in.
Yes, we are.
Suzette, put down that name and I'll talk to him.
She's working on it.
She's gathering
So
information.
did you mention what else goes on in the office yet today?
I did.
Okay, good.
We're going to go to Betty. She's got a right knee. I hope you have a left knee too. Hey, Betty. Well, a lot of people don't. You know?
I
That's
have
a
an
whole other
artificial right left knee.
You got a left knee? How long has your right knee been bothering you?
It's many, many years, and it gotten better, and then now as I have gotten older, it's really terrible.
What do you call older? How old are you, Betty?
I am 83, and I've been in your office. You examined my knee, and then you said I had to lose weight because I was an old beast. Ha, 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 laugh out loud. I was obese.
Do you mind if we ask
Now
you how
I'm
much
just
you weigh?
overweight for you, and I didn't know you wanted me to lose 70 pounds. I lost 53 pounds.
That's great. Come on back. Maybe it's time.
But you said, I spoke with you a little while ago, but I still was overweight for your concern. I have osteoporosis, and my doctor don't want me to lose too much weight.
Okay.
So I'm overweight for getting...
Hey, Betty, do us a favor. The radio show is echoing in your background. Do you mind turning it down for just while we're talking? I appreciate
Alexa,
that. Alexa. Oh, my God, that's so funny.
Can you hear me now?
Yep. So, Betty,
Alexa.
question. Betty, questions.
2.
Betty, how much do you weigh now?
I weigh 160.
160. You come on back. We'll take care of you.
And yeah, my BMI went down from 37 to 26.
Okay. BMI means nothing.
Oh,
Zero.
okay.
Yeah.
But I have no fat in my blood from the lab work that the doctor did.
Okay. I think you're doing great. At 160, I think we can help your knees. So.
Okay. I was trying to go through my workman comp.
Uh-huh.
Workman comp was a work injury.
Yes.
And when I talked with you before, before I even came into the office, you said workman comp would pay for it. And I got a claim adjuster that said she would pay for it.
Okay.
That the insurance would pay for it. And they sent me to a workman comp doctor. I'm seeing a young lady.
Okay.
I've only been doing it like 4 or 5 years, and she said I'm too old for stem cells.
Okay. Everything you've heard so far is wrong.
I know.
Okay.
That's why I'm calling you.
Yeah.
To see
I treat people 100 years old. I treat young athletes, teenage athletes, and it seems to work on pretty much everybody I use it on if they work it. It's not going to work if you go ahead and start running bases or running a marathon right after I treat you. You know what I mean? You got to chill afterwards and let the tissue grow in. I used this example before. When you plant seed on your grass, you don't go stepping on it and running on it, the same day or the same week. You let it grow and thicken up. And that's the same thing with regenerative medicine. We grow tissue, but you got to let it heal.
Okay.
And that's different for everybody. You could feel good the next day, but you still got to let it heal.
Yeah, I understand.
Yeah. So the osteoporosis, let me tell you the bunk that you heard on that.
Okay.
Your doctor didn't want you to lose weight because you have osteoporosis. That's a bunch of na-na-nu-nu. You know what na-na-nu-nu is, don't you?
Baloney.
Yeah, baloney. Words that we can't say on the radio.
Oh, okay. Yeah.
Yeah.
Dung.
Yeah. Your weight basically has nothing to do with osteoporosis. Your osteoporosis comes because your ovaries have shut down. They don't produce hormones anymore. All right?
And I don't have any of that anymore. I just had surgery last year.
Yeah, well, you didn't have it before either because by menopause, the ovaries shut down. Mm-hmm. So it wasn't because of your surgery. You probably had a hysterectomy or something, or
I had a hysterectomy a year ago.
Yeah, that has nothing to do with this. You had osteoporosis before that.
I'm sure probably did because I had osteopenia for the thinning of the bone. Then it went into
but osteopenia can be 1 millimeter away from osteoporosis, and they don't call it osteoporosis. So don't worry about the terms. Okay. Everybody gets osteoporosis as they age. Everybody. because their hormones shut off. Men and women the same. It doesn't matter. What we do if the patient wants to is we supplement their hormones and we rebuild the bone. I've seen many people have very bad osteoporosis and grow back the bone fairly quickly, like within a year or so. It happened to me. I'm thinking back, actually. All this stuff happens to me. I lost my testosterone very young from trauma to you-know-where, and my testosterone shut down, and I was feeling kind of lousy, you might say. And I met a man who looked great, who was older than I was, all pumped up, and I said, "How do you look so good?" And he said, "Why, don't you feel great?" And I go, "No." He goes, "Go get your testosterone checked." And it was very low, and I started supplement. Then I went to get a bone density done over at UCLA. This is when I was a resident there, and the practitioner said, "How could your bones be so osteoporotic already? You're so young." And I said, "My testosterone is low." Then I started augmenting with testosterone, and my bone density has grown back.
That's great.
So these things can be handled. Don't take, in my book anyway, don't take these medicines, these biphosphonates, because...
Oh, no, I definitely, when they asked me to take that, I said no.
That causes all kinds of problems. It causes jaw fracture, it causes proximal femur fractures, because what it does, it blocks the bone from breaking down, so you end up with old, fragile bone. It looks good on a bone density, but in reality, it's terrible bone. You don't want it.
No, I didn't take any of that, just regular calcium. And
that doesn't do anything. Doesn't do anything, darling.
The one said take calcium with magnesium.
Doesn't do anything. Weight-bearing exercises doesn't do anything. What does it is hormones. It's not bad to do that other stuff also, but in and of itself will not do the job. Now, I've read that OsteoForce, which are machines that you stand on and work out with, can actually help bone density increase. But the best thing that I know of from what I've seen is hormone supplementation with testosterone, progesterone, and estrogen for women, and just testosterone alone for men.
Is estrogen still a problem for women getting problem with their heart?
You know, you have to ask your doctor with that. I'm not your doctor. I'm not your heart doctor.
Oh, okay.
Yeah.
That's why I was with estrogen. I wasn't sure to do a supplement on it with that.
Well, by the way, if anyone ever does estrogen, don't ever do it by mouth. We got to run. It's the end of the show. God bless you all. Thank you, Nita and Suzette and Alex. If you want to call the office, the phone number there to get more information, free consult on the phone with my staff is 800-300-9300. Website, www.jointrehab.com. You can watch me doing videos of these procedures. God bless you all, and thank you.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab experts for free and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.